Most people treating joint pain are reaching for something oral, a pill, a supplement, a capsule they swallow and wait for. That's where the logic ends, and the problem begins. Because your joint tissue doesn't work like your digestive system. The synovial membrane, the cartilage, the inflamed tissue packed into a swollen knee or hip, those structures have limited blood supply. Oral anti-inflammatories struggle to reach them in meaningful concentrations, but what you put on your skin, directly over the joint, tells a completely different biological story. Castor oil has been dismissed as folk medicine for decades. What most people don't know is that its primary compound, ricinoleic acid, penetrates the dermis and acts directly on the inflamed tissue underneath. Not through your bloodstream, not through your liver, directly. And what happens in that tissue while you sleep is the part nobody is talking about. Here is what is actually happening inside your joint right now. The synovial membrane, the thin lining surrounding your joint, is chronically inflamed. When it stays inflamed, it releases pro-inflammatory cytokines, specifically TNF-alpha, IL-6, and IL-1-beta. These molecules trigger the production of COX-2 enzymes, which synthesize prostaglandins, the compounds responsible for the heat, swelling, and constant low-grade pain you feel every morning. But here is what makes chronic joint inflammation self-perpetuating. When the synovial membrane remains inflamed long enough, it begins releasing enzymes called matrix metalloproteinases. These enzymes break down the collagen matrix of cartilage itself. The more cartilage breaks down, the more bone-on-tissue friction occurs. The more friction, the more inflammatory signaling. The more inflammatory signaling, the more matrix metalloproteinases are released. It is a self-reinforcing cycle with no natural stopping point. This is not acute pain, the kind you feel from an injury that heals. This is chronic inflammatory pain, the kind that never fully resolves because the biological environment driving it is never fully addressed. Castor oil applied topically before bed targets this cycle at 3 specific biological points: prostaglandin suppression, lymphatic drainage facilitation, and direct cytokine modulation in the periarticular tissue. Not the pain, the process generating the pain. Ricinoleic acid, the bioactive driver. Castor oil is approximately 85 to 90% ricinoleic acid. This is not a generic fatty acid. Ricinoleic acid is a hydroxylated unsaturated fatty acid with a unique molecular structure that allows it to penetrate the stratum corneum, the outermost layer of skin, more effectively than most topical compounds. A study published in the Journal of Inflammation examined ricinoleic acid's effect on prostaglandin synthesis in inflamed tissue. Researchers found it significantly inhibited prostaglandin E2 production by acting on EP3 receptors, the same receptor pathway targeted by NSAIDs like ibuprofen, but without systemic gastrointestinal effects. This means the mechanism is real and measurable. The anti-inflammatory action is not anecdotal. It is receptor-mediated and tissue-specific. When applied over an inflamed joint, ricinoleic acid reduces local prostaglandin activity directly at the site of inflammation. It does not pass through the liver first. It does not dilute through systemic circulation. It acts where you place it. The unexpected benefit: ricinoleic acid has also demonstrated activity in the gut lining's EP3 receptors, which is why castor oil taken orally has long been used to stimulate intestinal motility. For joint users applying it topically, this mechanism is irrelevant, but it confirms the biological potency of this compound at mucosal and connective tissue surfaces. The castor oil pack, occlusion and penetration enhancement. Castor oil applied open to air delivers 1 level of penetration. Castor oil applied under a warm compress, flannel cloth, or occlusive wrap delivers something measurably different. Occlusion, sealing the compound against the skin, increases percutaneous absorption by creating a microenvironment of elevated temperature and humidity at the skin surface. A review in the European Journal of Pharmaceutics and Biopharmaceutics confirmed that occlusive application can increase the penetration of lipophilic compounds into deeper tissue layers by 2 to 4 times compared to open application. For joint inflammation, this matters enormously. The synovial membrane sits below fascia, muscle, and subcutaneous fat. Getting ricinoleic acid to that depth requires maximizing dermal penetration. A warm castor oil pack worn for 45 to 60 minutes before sleep or kept on overnight with a low compression wrap creates exactly the absorption conditions needed to deliver meaningful concentrations to the periarticular tissue. The unexpected benefit: occlusive heat therapy applied to peripheral joints has also been shown to improve local microcirculation and reduce overnight cortisol spikes in the applied area, a mechanism relevant to individuals whose joint pain worsens under psychological stress. Sleep timing: the biological advantage of nighttime application. This is the part most people overlook entirely. Inflammatory cytokine activity follows a circadian rhythm. TNF-alpha and IL-6 peak between midnight and 4 a.m. This is why joint stiffness is worst in the first 30 to 60 minutes after waking. Your body's inflammatory signaling was running at full volume while you slept. Applying castor oil before bed does not fight inflammation reactively after the damage signal has already peaked. It places an anti-prostaglandin, tissue-penetrating compound directly over the inflamed structure before the inflammatory peak occurs. A paper in Annals of the Rheumatic Diseases confirmed that cytokine surges in rheumatoid and osteoarthritic joints follow measurable nocturnal patterns. This is not a coincidence in timing. It is a biological window. Applying ricinoleic acid before that window opens means the compound is already present and active in the periarticular tissue when the inflammatory cascade begins. Same joint, same level of damage. Completely different inflammatory environment at 2 and depending on whether that tissue is bathed in ricinoleic acid or not. The unexpected benefit: this nighttime application window also aligns with peak growth hormone secretion, the anabolic phase during which connective tissue cells attempt repair. Reducing the local inflammatory burden during this window may create a more permissive environment for the limited regenerative activity your synovial cells are capable of performing. Magnesium oil, the cofactor most protocols skip. Castor oil alone targets prostaglandin synthesis and tissue penetration. But there is a second inflammatory driver that castor oil does not address: NF-κB activation. NF-κB is a nuclear transcription factor, meaning it operates inside the cell nucleus and controls the genes that produce inflammatory cytokines. When NF-κB is chronically activated, it keeps the TNF-alpha and IL-1 beta production lines running regardless of what else you do topically. Magnesium deficiency, which affects an estimated 70 to 80% of adults over 50, according to survey data in the Journal of the American College of Nutrition, directly amplifies NF-κB activation. When intracellular magnesium is low, the cells of the synovial membrane and surrounding connective tissue are primed for inflammatory overstimulation. Transdermal magnesium chloride, commonly sold as magnesium oil, applied alongside castor oil before bed addresses this second pathway. A pilot study in PLOS1 found measurable increases in erythrocyte magnesium concentrations after 12 weeks of transdermal magnesium application, confirming that skin absorption is a viable delivery route for this mineral. Applying a small amount of magnesium oil to the joint area 5 minutes before the castor oil pack creates a layered topical protocol. Magnesium chloride modulates NF-κB activity and intracellular inflammation signaling, while ricinoleic acid suppresses downstream prostaglandin synthesis. 2 targets. 1 application window. The unexpected benefit: adequate magnesium also supports calcium channel regulation in cardiac muscle cells, which is why correcting magnesium deficiency is associated with reductions in blood pressure variability and cardiovascular event risk, independent of joint outcomes entirely. Begin with transdermal magnesium chloride. Apply 6 to 8 sprays of magnesium oil directly to the skin overlying the affected joint. Rub in gently. Allow 5 minutes for partial absorption. Next, apply a generous layer of cold-pressed, hexane-free castor oil, approximately 1 tablespoon per joint, directly over the same area. Cover with an unbleached flannel cloth or cotton wrap. Apply a low heat pad or wrap with a compression bandage to hold warmth and create occlusion. Leave in place for a minimum of 45 minutes or wear overnight secured with a light wrap. Perform this protocol 5 nights per week. Not occasionally. Consistently. Timeline. Within 3 to 5 days, morning stiffness duration begins to decrease measurably. Within 2 weeks, range of motion on waking typically improves and nocturnal discomfort reduces. At the 30-day mark, individuals maintaining consistent nightly application report significant reductions in baseline pain scores, the kind of difference you can feel during your first steps in the morning and measure in how long it takes to feel mobile. This will not rebuild cartilage that has already been destroyed. Let that be clear. No topical compound can reverse structural joint damage that has accumulated over years of chronic inflammation. What this protocol does is reduce the chronic inflammatory environment that has been silently continuing that destruction every night, unaddressed, while you sleep. It gives your joint tissue the biological conditions it needs to stop getting worse. That is not a small thing. For many people, stopping the progression is the most meaningful outcome available to them. Inflammation does not build up overnight. It will not disappear overnight. But address the root cause consistently, the nocturnal cytokine peaks, the prostaglandin synthesis, the magnesium deficit driving NF-κB activation, and your body will respond. Biology responds to conditions. Change the conditions. If this kind of science-backed content is what you are looking for, subscribe to Heal Logic Health. We only publish what the research actually says.